Hi, my name is Shelby. This is my discussion post for week 5, chapter 5 discussion. Our questions after watching a lecture were, why do we have such a hard time talking about death? How do we facilitate effective end-of-life communication within the family? And how do we facilitate health end-of-life discussions between patients and providers? So first up, talking about death can be sometimes difficult, one, because of the fear of the unknown. Nobody actually knows what happens after death, and sometimes religion can get in the way of that and can be a roadblock between patients and healthcare providers. It's emotionally distressing as well, bringing up grief and things that people have lost. People try to avoid that conversation. So it also challenges the idea that life isn't forever and that death can happen anytime. So talking about death can be very uncomfortable. Unfortunately, it happens though. So how can we talk about end-of-life stuff with the families? One, I think in our lecture, we talked about dignity and safety. So creating a safe place for the family while they are going through something traumatic is always needed. To be honest about things on what happened during the process, to respect where everybody is at, whether they're grieving and coping, to making sure that the family is okay and also knows what's going on during the entire process. We also need to make sure that the family is getting professional help if they need it. Sometimes therapists or psychiatrists are required. And also talking about the practical things, maybe not just medical with the family. Lastly, how can a healthcare provider talk to patients about death? Again, I think the dignity and a comfortable space is important, and being honest with the healthcare providers as well. Being patient and giving the patients or in the families time to process and everything that they just went through, to understand their values and respect their values. Again, like I said in our question number 1, that religion can sometimes be a factor in death and what to do after death or death in the family. So respecting their boundaries, their beliefs, and also working as a team. This doesn't need to just be a one-on-one doctor to patient thing, but getting nurses, social workers, psychiatrists, therapists involved as well. And also discussing planning on what happens after to make them feel a little bit more prepared and what to do post patient healthcare interactions, what to do about funerals, where to next, how to plan out wills, etc., all those things, and funeral plans as well. Thank you.